Okay, so we talked about a bunch of sensory perception, and we're going to focus here. We're going to focus on the eyes, okay? So I'm going to talk to you, let me show you the definition, which is the ability to receive sensory input through various psychological processes in the body, to translate stimulus data or meaningful information. So that's with everything, right? Sight, hearing, touch, all of it. So now we're going to, the exemplars we're going to talk about are cataracts, glaucoma, macular degeneration, and myopia and presbyopia. Okay, so these are the things we're going to focus on. And I'm going to show you anatomy of the eye as we go. I have a couple of slides in the anatomy of the eye as we talk about different diseases and disorders of the eye. So just if you remember your anatomy and physiology, you can look at different areas. And the first one of the eye, and the first one we're going to talk about the lens. And the lens involves a deficit is glaucoma. That's where we have problems when we have glaucoma is in the lens. Anybody here works in surgery or is a tech or anything, or have? Oh, so you've done. You want to come up here and tell them all about it? No, I'm just kidding. You can add what I forget, because I feel like I always forget something. Okay, so cataract surgery and the etiology. So the cataract is the lens. So if you can see up here, you have a normal lens, and then you see you have the little cloud on the cataract. So that's a cloud. So what happens there is the old lens fibers compress. Anybody have an old dog? Okay, who has cataracts? Okay, because they get older and they get cataracts, same as with a human, okay? So they compress and the new fibers are produced on the outer layer. So that, all those little fibers, that's what causes the cloudiness. So it forms crystals, so that's what you're seeing right there. And so you lose your transparency. So here, most of the time it's age. A lot of times with cataracts, it's age, and because the lens loses water. The older you get, the drier your eyes get. Anybody has dry eyes in here? I just started getting them, and it's really aggravating. Like when you sleep, sometimes you get dry eyes, and that can attribute to cataracts. Trauma, of course, if someone gets something, a sharp, blunt object in their eye, some type of trauma to the eyeball, that can cause it. It can also be from radiation exposure, radiation therapy on the face. Corticosteroids can also cause it. Overuse of corticosteroids. Complications like retinal detachment or glaucoma. We won't talk about retinal detachment today. You'll talk about it as you go up the next couple of semesters. They'll focus more on that. And then, also, it associates with diabetes, Down syndrome. You'll see it in patients who have hypothyroidism and chronic sunlight. People who work outside a lot, you'll see they'll have cataracts. These disorders, something I forgot to say from the beginning. These disorders or diseases that I'm going to talk about, unless you work in surgery or pre-op or post-op as a nurse, you may not actually interact with the acute phase of this, but you will see someone that may have had or past health history or has or is going to have surgery with these disorders or diseases. Cataract is a disease, it can be corrected. Glaucoma cannot be corrected. Macular degeneration cannot be corrected. So glaucoma and macular degeneration are things that these patients will have, and they will have to actually deal with that, plus whatever else is going on in the hospital, whether they have a fracture, heart trouble, something like that, okay? Anybody took care of anybody so far with these diseases or disorders? Blind? Okay, completely blind, okay? What did you do for him?
Everything.
Everything? But he could hear okay?
Yeah.
Mm-hmm.
He
He was blind from birth, or was he diabetic?
Yeah.
Okay. So did he tell you how he became blind? Was it difficult to take care of him? You had to talk to him a lot, I'm sure, right? And tell him everything you were doing. What about when he ate? You had to tell him about where everything was, and he used a little clock, 12, 3, 9, 6, tell them where their food is, right? So it's a lot of work, okay? And you had to take care of someone?
Not occasions. My grandfather was
Oh, yeah. So we're going to talk about that in a minute. Go ahead.
It was just, he went from, I mean, kind of progressed pretty quickly. I don't know if that's normal, but he had to have like these big magnifying devices that kind of put magazines and books and stuff under them. That everything
Right.
magnified them so large.
Right. Yeah, it is, and it can be something that's rapid or something that is chronic condition. And I'll tell you a story about that too late in a few minutes when we talk about that. So these are all the complications and reasons why you can have cataracts. So in your assessment, you want to consider their age. That's usually the prominent reason why they have cataracts. You need to ask them, tell me what you can see well, okay? You say, what do you have difficulty seeing? And so then you can do an assessment so they know you may have to put objects closer to them, okay, for this. Any recent trauma, if there is an chronic, if they're younger, usually it's something from something happened with trauma, radiation, or something like that. Exposure to radioactive materials. It could be from systemic diseases, like we just talked about, medications, and there's a whole list of them in the book. Those are just something. And intraocular disease. And we'll talk about intraocular pressure in just a moment. And you can see when you have an increase in intraocular pressure after time, it can wear on the lens and it can cause a cataract. So the early signs, they start having blurred vision, and they feel like they just can't see and they need glasses. So they think they just need glasses. Lots of times it decreases the color perception. Sometimes they have blurred vision or double vision. They may not be able to see as well at nighttime, so they might have photophobia, and then it goes into blindness if it's not treated. But it's really easy to treat these days. So this is what it looks like when you have a cataract. And then who wore glasses, the cataract glasses? So you know it kind of looks fuzzy and you can't really see anything. So now you know what your dog feels like. So my dog is 16 years old and he can't see anything. So when I put my hand down, he's thinking that I have food. Every time I walk by, I put my hands up like this and I'm cooking and I go to put my hand down, he goes by my hand because he thinks like I have something in it. And he smells my hand, he's like, oh, I don't have anything to eat. It's just a hand. But so he has a really bad cataracts. So fear of blindness, loss of independence is a big thing, right? Safety is a big thing. With all these eye disorders and diseases, always think of safety. Especially we'll talk about when they go home, what you would do for them, what you would teach them before they would go home. If you become a home health nurse, we'll talk about that also. Okay? So encourage expressions if they have concerns for that. So preoperative care, you want them to do an informed consent. So usually they'll do the consent in the office with the physician, nurse, whatever, before they go to the surgical center, because they start instilling drops in their eyes before they come to the surgery center. So there's a lot of teaching going on because you have to teach them how to do it before they come, how to instill the drops. And we'll go word for word on how to instill drops in a minute. So you want to make sure they are able to do this. If they can't, someone's able to do it for them, and then they get the drops in there before surgery. Then, if they're taking aspirin, Plavix, Xarelto, whatever surgery, anytime you have surgery, you have to stop any blood thinning, Coumadin medications. Okay, so you have to really do a lot of good teaching. So the treatment. They take this little probe, okay, and they put it in the eye, and they just kind of break up the crystals, okay, and the little parts in the lens. Now the capsule right here stays intact. So what they do is they put it's a high frequency sound, it breaks it up into small pieces, and then they remove it by suction. And then after they remove it and everything's gone, they take an intraocular lens and they pop it in, and that's it, and it's clear. All right, and so that's easy, it's an easy procedure, okay? And so it's like a little implant they put in the eye. So then usually they discharge in about an hour, and you tell them they don't have any problems. Wear dark glasses outside in a brightly lit environment. They may have a little mild itching and redness, that's perfectly normal. Tylenol for pain, but the vision will progressively get better, okay? So lots of them think, oh, they putting this in, and tomorrow I'm going to see good. Well, maybe not. It's still going to be fuzzy. They still have to go through the healing process. But by 4 to 6 weeks, they should have good vision. And, of course, they're going to go back to the doctor for a checkup Okay, and then also to avoid activities. This is the important thing that might increase intraocular pressure. So you want to tell them not to bend from the waist, lift anything 10 pounds or more, all these things that strain anything up in your head, up in the area would strain your eyes. Coughing, sneezing, having a bowel movement. If you wear tight clothes, tight shirts, your head in the dependent dependent position. So you don't want them bending over. If they can avoid it, tell them don't even stoop down, because 9 times out of 10 they're going to stoop, and even if they keep their head erect, they are going to have that tendency to put it down. So you don't want them to do that. Also, when they're bathing, a couple of days to bathe, after surgery, and you don't want them to immerse their head in water, of course. They can wash their hair after a few days, but you want them to just wash their hair and let the water run down. You don't want to get anything in their eyes. Okay? So make sure that they tilt their head back. Even light housework, vacuuming, sweeping, it's strange. You wouldn't think it, but when they're vacuuming and you're straining, actually straining their eyes and their head. So just sit back and relax, tell them, don't do a whole lot. And make sure they wear glasses when they're in light or in the sun. It's the best way, I think. These are complications. They can have sharp pain in their eye, bleeding, yellow, thick mucus would mean infection, right? Swelling could be infection, bloodshot sclera, could have a bleed behind it, decreased vision, flashes of floating lights, retina detachment, things like that. Usually these things don't happen. I worked in a ambulatory care facility. I did everything, endoscopy, all kind of stuff, post-op, pre-op. And in the afternoons, I would stay lots of times. They would want me to stay, but so I'd do it. And eye doctor would come in around 2 in the afternoon, and we'd do like 10, like boom, 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 in and out. Takes a second, So they come with their little drops, and we'd talk to them about them, put them in, show them what they know, what they didn't know, help the family member, bring them in, bring them back, do a discharge, and it was quick. And they were in and out of there 3 hours max. So they were gone. So, but any of these complications should be reported to the physician. So this is it about cataracts. So any questions about cataracts? Nope. Come on, y'all, get lively a little bit. It's my last lecture this semester, so y'all need to interact for me, please, just a little bit more. I'm almost done. Okay, so glaucoma. So glaucoma is a group of disorders resulting in intraocular pressure, come from different problems that you may have. So what happens is, what's a measurement of the IOP should be done every 2 years. So when you go over 40, so when you go to the doctor over 40 and you have an eye exam, you should go every year for your eye exam, and people usually don't. They don't have any eye problems or need glasses or contacts, they usually just don't go. But they should, because it needs to measure the intraocular pressure of your eye, because that can denote some type of disorder which can cause glaucoma. And you really don't want to get glaucoma. Who had the glaucoma glasses on? So it wasn't any fun, huh? So you lose your peripheral vision, okay? You lose your peripheral vision. Okay, so over 40, you should get your eyes checked. Often enough, eye injury or African American or over 65 or steroids. It's a little pattern. Usually it's with age and steroid use that you have problems. Usually it's painless and you're not aware of it until later on, because you think just your vision is getting reduced. You don't feel like anything else is wrong. So what happens is you absorb the flow, and I always have to look at this and see to maintain the flow between the iris and the cornea. So here's your iris and your cornea, and so the flow is coming in and out normally. That's normal flow. So what happens is the flow that's going in is greater than the flow that's coming out, and so the fluid that's going in is causing pressure, okay? And that's what causes the disorder, okay? And it actually causes permanent damage to your eye. So the drops and the procedures that we're going to talk about in a minute, it does not correct it. It only helps it. It only maintains your eyesight. So that's the difference in a cataract, where you can pop the lens in and out and then you can see again. You cannot with this disease and with this disorder. So types of glaucoma, you have 2 different ones, and you have the primary open angle, okay, and it's where through that chamber and that angle that I showed you of the eye, what happens is the fluid, it reduces, the angle reduces, so it stops the fluid from getting out of your eye, okay? And then it usually affects both eyes, and there's no symptoms, like I said early. Where the closure is, it's more acute. It comes just like with cataracts problems with it. It still blocks, it still obstructs, but it's usually quicker, and it may come from usually a tumor. But it can be trauma, but usually it's somebody who has a tumor, and that's usually what happens. So it's also acute, it's less common, it's sudden, and it narrows the angle, and it displaces the iris some. Because when you think about this one, think about it displacing the iris because of a tumor behind it, and that'll help you remember that, okay? So with the open angle, and you have the intraocular pressure, it just is larger. Usually it's 10 to 21, and it just goes up. When they do a measurement, it's 22 to 31. And then you have atrophy, which means it narrows and gets smaller, right? Okay, and you have a gradual loss of your visual fields, and central vision is unaffected. And I'm going to show you a picture of this in a minute. So it also gets foggy. You can have an aching headache, frequent changes in glasses. Late, you have halos, irreversible loss, and you lose all your peripheral vision. Didn't somebody in here say somebody knew somebody? No, it was macular degeneration. So with the closed, the PACG, it's more sudden, and then because it's sudden, the intraocular pressure, look how much higher it is. It's at 30. Okay, so that, and you have more sudden pain. You usually get brow pain, severe headaches, and then you get nausea and vomiting. You have a question? Oh, yeah? Race, she's completely blind? So sad. Because, even the drops and all and everything they did they do any of the laser procedures on her or anything? No? She's a diabetic? I'm going to tell y'all, when you have diabetes, that affects the eyes. It targets the eyes and the kidneys. So remember that. So you don't want diabetes. So if it's a precursor in your family or you're predisposed, make sure you exercise, eat right, and lose weight. And if your husband or significant other, wife, whatever, make sure they lose weight. And if they're obese or whatever, or a little bit overweight, and they have these problems with family, the family, and they have because diabetes is a very genetic disorder. You'll learn more about that, but it is genetic. Usually skips a generation. Y'all ever heard that? It's true. And it's true it does, and it's true it's genetic. You notice that, and then if it's a late onset, type 2, and you'll see that more than likely someone in their family had it. It was a grandparent, like their grandparent had it, So make sure that you eat right. Now, it doesn't mean that you have to be, if you're a little bit overweight, it doesn't mean so much that you're going to get diabetes, because I know people who are very thin and really weigh less than they should and have diabetes. It shows it's a genetic factor, but if you eat properly is the thing, and get the right exercise. And if you do become a diabetic, please check your sugar and take your medication and on your medication regimen, because I've seen so many people not follow what because when you're a diabetic, you feel okay, right? You don't feel bad. That's what happens. And then all of a sudden, all these things start shutting down in your body. And this is one that goes. I'm going to tell you about my dad in a minute. And he was compliant, so he had some issues. So anyway, so you have a sudden severe pain. This is with the closure of the glaucoma, nausea and vomiting, and we discussed that. So it's sudden. So this is what glaucoma looks like. Normal vision, glaucoma. Okay? Normal vision, glaucoma. So the drug therapy, look in your book and know these beta blocker, beta adrenergic blockers. You just need to know the classifications of them and know that they are used for glaucoma patients, okay, and what they do just for the body, for glaucoma, for the eye. And then know that you're going to teach your patient how to work the eye drops. And I'm going to read Instillin eye drops to y'all verbatim. And the reason why I'm going to do that is I just want you to sit back and listen so you can kind of start putting it in your head. All right? And anybody instilled eye drops in their patient yet? No? Okay, so, huh? A gel, but you know, did you back there, you?
Yeah, it's actually more of like a lubricant.
A lubricant? Okay, well, I'm going to show you. You have a question? Okay, so I'm going to just read it in the next couple of slides, and you have it in there. And then you need to practice that. It doesn't have to be today or tomorrow, but just practice it during the summer. Put in Visine in somebody else's eyes, because you really need to do that, because you are going to. If you didn't do it yet, you will be putting drops in someone's eyes, if not by the end of the semester, but in the next couple of semesters. So you need to know the right way. All right, but anyway, so eye drops, know how to administer them, and make sure they're compliant with them, because the eye drops will maintain and prevent the progression of the disease. It won't stop it, but it'll stop the progression of it. And that's something that they need to really understand and know. A lot of people think the drops are just going to cure it, and it's not. So you need to talk to them. So you wait 10 to 15 minutes between drug, and we'll talk about that, and to prevent washout, and to avoid activities increasing. So what would increase intraocular pressure? If they had to avoid, because when you're increasing it, what happens? It's going to make it worse. So what would increase it? Think about cataracts. What did I tell you not to do? Lean over, bend over, what? Put a lot of what? Lift heavy things, anything that's going to strain that increases. You'd be surprised some of the things that increase IOP. So you need to look at that, look it up if you don't know it, and make sure that they understand it. Give them a handout, a pamphlet about it, okay? Okay, so let's go through this really quick. So, Instillin a drop. So the first thing you want to do is check the name, of course, the expiration date. And these are some of the little important things. Check to see whether one eye or both eyes, right? Just like surgery. Where are they doing the surgery? Right, one eye. You don't want to put it in both eyes if they don't need it. So check on that first. That's important. And then if they need both eyes, if one's infected, what are you going to do? Use 2 separate bottles. That's common sense, right? You're not going to use, and then label them. Make sure you label them. Right eye, you can even put, are infected, left, with nothing on it, showing that's not. For the next nurse, make sure you wash your hands, of course, put your gloves on, explain the procedure, ask the patient to tilt their head backwards, and look toward the ceiling. Okay, a lot of them don't want to do that because some of them are dizzy, weak, and it makes them feel like they have an equilibrium problem. So you need to be gentle and take your time with them. Putting drops in, don't just throw their head back and say, I'm putting drops in. I've seen nurses do that. So gently pull the lower lid down against the patient's cheek, forming a small pocket. So down here you form a small little pocket. Hold the eye drop bottle with the cap off like a pencil, okay? And then you're going to rest your wrist, holding up here where it says rest your wrist against the cheek. It should be cheek, not check. And then without touching any part of the eye or the lid, with the tip of the bottle, gently squeeze the bottle to release the prescribed number of drops into the pocket you have made with the patient's lower lid. Now what happens if you miss the eye and you just get the cheek? Right, just put another drop in. Always have a little gauze, a little towel by you, so if that happens, you can just pat the drop off and then just go ahead and just put but don't make sure you don't put too many drops in, okay? So it's okay. Don't flip out or anything. If you don't do it, you don't get it in, it's all right if it's medicine. Then you gently release the lower lid. Tell the patient to close their eyes gently and not to squeeze them. And then you also want to press and hold the corner of the eye nearest to the nose. So right here, because why is that happening? Right, systemic absorption. So that's important for you to know. And without pressing the lid, you can gently blot away any excess drug. Then you can remove your hands. And what I tell them to do is I go wash my hands. And when I wash my hands, I say, keep your eyes closed. When I'm finished washing my hands, I tell them to open their eyes. And then by that time, the drug is absorbed into the eye. And it's doing its work, okay? So this is something you're going to use for the rest of your nursing career. That's why I take my time and I go over it. Diagnostic test, this is just FYI for you to know. Tonometry, it indicates you have tests that measure the intraocular pressure. You have some tests that inspect the optic fundus of the eye and measure the depth of the eye. The other one measures peripheral vision loss and central visual field. And they do that at the eye doctor. And then sometimes what they will do is they will also do it when you're in the hospital or for checkups if need be, if they're going to have surgery. Sometimes they do these surgeries, and when they do this little surgery, it's just a laser. And do you remember the eye? So put the eye in your head I showed you. So what it does, the laser burns the spaces and makes like a little fistula. So what do you think can happen? So the fluid can come out, right? But they may have to have these surgeries 3 or 4 times. This isn't something that's going to correct it. Remember that. It's just something that's going to help get the pressure out of your eye. Okay, so it drains the aqueous humor from the anterior eye chamber, and the laser promotes drainage. So it widens to increase the flow. So all it does is widen a little tip. The eye's so amazing. So what happens over time? The fistula is going to close. So y'all know what a fistula is, correct? Okay. Sorry, my throat is dry. All right, so that's pretty much everything about glaucoma. Do you have any questions about glaucoma? Nope. All right. Whoop. So macular degeneration. So I know your grandmother last had macular degeneration. And then we had a couple last hour. A parent and a grandparent or whatever had macular degeneration. And what that is the area, who wore glasses with macular degeneration? With the one, you did? Anybody else? With the little, they had the little labels on there. Somebody was trying to peel it off. What was that? Anyway, so it just like, it makes you feel like you can't see anything. So what are you going to do? Where are you going to put the patient's needs or the ADLs or whatever they need to do their food? On the side, right? My cousin has macular degeneration, and she's been having it for a really long time. She told me she had it for she's been having it probably about 5 or 6 years. She does the medicine and all that, but there's no cure for it. It's just like glaucoma. You still will have it, and it's just progressively getting worse for her. And she just went to the eye doctor to get stronger glasses, and just said, you said about your grandfather, she just got books in big print now, and she reads books a lot. She's retired, she reads a lot of books, but she told me that she feels like she's got a piece of dirt in her eye all the time. So if you can think about that, where it's always out of focus, and you got to keep clicking, and it's like you have a piece of dirt right in the center. And if anybody wore those glasses, it's kind of what it feels like. You have something right in the middle, and then all you can see is the sides. It's got to be very annoying, very frustrating, very aggravating. But she said she compensates for it. So there's 2 different kinds, and one I'll explain to you, but it's a deterioration in the macular. So let me show you right here. Here's your macula right here, and it is in the retina, okay? So it's in the center of the retina is where the macula is, and that's where you start to have the deterioration, and it becomes necrotic. So that's what happens. So as that becomes necrotic, and it becomes atrophy and smaller, and it dies off, that's when you start, and it can be slow, progressive, or it can be quick. But most of the time, it's a chronic disease, okay? So there's 2 types, dry and wet. And wet usually occurs in a younger generation, or it'll occur after the dry, okay? And it's usually age-related most of the time. All right, so pretty much talked about that. Most common is the dry. It causes a blockage in the renal capillaries. So way back here, I don't have the little pointer, but right back here, you have little capillaries, right? And what happens is they become necrotic, the rod becomes necrotic, the photosensors back there in that part of the eye, it becomes small, just like the renal cells, and your central vision begins to decline at that point, okay? And then associated factors could be smoking, cardiovascular disease, genetic history. Caucasian race usually has it. Lots of times it's in women, just like with my cousin. diet is poor, a decrease in vitamin E. And for her, it was a genetic factor because her grandmother had it on her father's side, and now she's got it. So sometimes it can be from smoking. What happens when you smoke? You get what? Your vessels, right? So it all to do with and look, this blocks the renal capillaries, so it shrinks them up. So you have dry, and then there's no cure for it. It focuses on slowing the progression of the vision. It maximizes you can have vision loss, you can become blind. Vitamins, different types of vitamins, and they have this different types of zinc, can help with slowing the progression down. It never can really cure it. Okay? That's just an FYI slide. Then you have wet AMD. And wet is, you already had dry, and then you have wet. And what happens is new blood vessels try to regenerate, and the walls result in leakage, and the blood flows through, and that causes like a wet blood degeneration, and it's still blocked, still the same thing, but they just call it wet. Exudate of the macular degeneration. It's just a type of wet degeneration. It can happen in one or both eyes. It can be sudden, and the fluid in the blood may reabsorb in some of the patients. But then you have, if it's wet, then you have to go in there and you have laser therapy, and it seals the leaking blood vessels, and the vascular endothelial growth and the factors inhibit. So, do you want to add anything?
One of the things, I don't know if you have it on another slide, with the wet AMD, since that progression, it can be the way we would send the patients home with a magnet grid to keep in the refrigerator, and whenever they're in the kitchen, we would just remind them daily, twice a day, to cover one eye at a time and make sure that those lines always stay straight.
Oh, no, I don't have that. That's interesting.
Nothing was missing. There weren't any black areas. There wasn't any distortion. Looking at like door frames to see if it had a wave to it.
Right.
That self-monitoring was the first line of defense to know if it's changing.
Yeah, because my cousin says that. She'll get that wave. She just went to go to the doctor about a month ago because of the wave she had. So, yes, that is.
The
Wait.
growth factor inhibitors, they actually inject them directly into the
Right, right.
It originally was a chemotherapy drug for colon cancer. And
Oh, I didn't know that.
Yeah, they were finding that it was fixing wet AMD.
Wow. What? Okay, yes. So, okay. All right. I'm going to have to look that up. If we have to write that down for me. I'll add it to my slides because it's interesting. I didn't know that. And that's not in the book. But I also, my dad, a few years back, I tell my students this all the time, he had, not that he was diagnosed with macular degeneration, but he's a diabetic, onset type 2 when he was in his 50s. Takes care of himself, does everything he's supposed to do, but his eyes started going out, he started losing his vision, and he started having like this wet AMD where all the little capillaries were breaking up and his vessels were leaking in the back, and he went totally blind in one eye, and then he went blind in the other eye. And Miss Strength remembers because I went through that when my dad was blind completely. And it was for, I don't know, how long, about 6 months or so, a year. And so they went in and did the laser therapy like 3 or 4 times to seal leaking vessels. And then they did the injections and multiple injections. And it took about 6 or 7 months, but he got his sight back. It was a miracle.
They do it like a course of 4 of them.
Yes.
Between,
And my brother said, how do you get those injections in the eye? And I looked at him and I said, if I was blind, I would go get whatever I had to get in my eye so I could see, because I'm going to tell you what, very active man, always worked all the way until he was 75 years old, still going around. He's getting ready to go to Italy. He's 82 now, and he's going to Italy in October. He lives his life to the fullest. And so he told me when he went blind, it was horrible. I'd cry. It was terrible for me to see because he was so active. And what happened was, like, who had the blindfolds on? The people had blindfolds on. He would get sick in the car and dizzy, and his equilibrium would go, back and forth. They sent him to the Lighthouse of the Blind. He learned a lot of stuff. He got the big magnifying glass, like she was talking about, to be able to read. And what he did in his retirement every day, he did puzzles, he watched TV, old movies and stuff, and he read a lot. So those are all things you need your eyes for. Everything else, he was a ball player till he was like 50. He played tennis till he was in his 60s. So he was very active. So he he stopped doing all that, so all he had was his reading and going to Walmart and Target and things like that and picking up his medicine. But he's still active, and I attribute his health to living 82 with his diabetes because he takes care of himself. He checks his blood sugar. He takes his insulin. He was on insulin, now he's not. Just because he takes really good care of himself, or he tries to. But he had that, and he told me, he said, I never want to lose my sight again. I said, well, don't eat any ice cream then. Because he used to eat gallons of ice cream when he was younger. I said, you can't, not a whole gallon, but half a gallon. But you can't do that. So I said, don't eat ice cream, and make sure you don't eat cake, because he likes sweets. But he eats all the right stuff. He's supposed to eat cheats every now and then, which you can, but he doesn't eat all the time. But he takes even more care of himself because he doesn't want to lose his eyesight. Yeah, and it was real hard for me. And I used to cry to Miss Strength, I don't want my dad to, because y'all don't know, but Miss Strength and I go back a long time because her dad and my dad were in the Knights of Columbus together, and we had no idea until we met again. We reconnected years later, and she went to school with my brother. We all went to the same school together when we were real little, Isn't that funny? I know. We all lived in Lakeview, so it's really fun to reconnect. So, so she knew who my dad was, and also made it more, personal. Anyway, okay. So, but anyway, just that's a little ad lib for y'all. That's not going to be on the test. So, that might be, we ought to put that a bonus question. What instructors knew each other from childhood? How much strength? A, Miss Vickers. B, Miss, no. Okay. I know. Y'all would be the only ones that know. Well, now everybody, because they're listening to. But anyway, huh? Yeah.
It's all the above.
Yes. So my dad had laser and leaking, but he never did have macular degeneration, but he had the same thing, predisposed from these things. So I always like to tell y'all about that, kind of put it in. So this is what macular degeneration looks like. This is an example, normal and macular degeneration. So, you have any questions about that? Anything you want to add?
I just wanted to say more that Ms. Strike had asked me, does it hurt when they do the injection into the eye? And
I can answer that.
like the thought of having that done, you're absolutely petrified. But if you look at that picture,
Uh-huh.
you lived an active life like your father did, and you have an opportunity to get rid of that.
Oh, blindness. He was completely blind, both eyes. He's still blind in one eye.
They will, they'll do it, but
He takes it.
it's not.
He still gets them.
It's more of a pressure feeling.
Yes.
You do numb the surface.
It's in your head.
Yeah.
Because he said it does get numb, and then he said if he does it, because my brother said there's no way. I said there would be every way. I would be in that chair all the time. I would take a Valium, a Xanax, whatever I needed to do, knock me out, drink, whatever, but I would get that because I would never want to lose my sight. It hurt me to see him lose his sight. What were you going to say?
I had LASIK surgery and it feels like your eyes would
Pop out? Yeah. Yeah, it does. When they do cataract surgery, too, I feel like cataracts are worse than having that injection. Because when you see that little probe going in there, because I used to help,
It's so close that your eyes dilated.
Right.
But
and they right there, your eyeballs.
they'll say it's psychedelic. It reminds me of the 60s, man. That's what they say.
It's kind of weird, I know.
There's a lot of color.
Yes.
But it's
Yes.
pain, and they don't use stitches.
I know. Just pop it in and out. It's amazing. The eye's so amazing to me. What? Yes, Miss Strength. Oh.
They, I used to take my students, my juniors, to the eye clinic.
Y'all listen up. You might learn some.
And they would kind of sedate them, and they put this thing to soften the eye by a real pressure thing, but they would inject, and this guy would go, and I'm like, oh my God.
You know what I don't like?
They were injecting the rectus muscles to keep it still.
Oh, gosh.
Yeah, what he mom does, like, oh.
You have to knock me out. Oh, I hate when you know how they pull the eye open, you guys, for surgery? And they retract it and they pull that lid back. Oh, it grosses me out. I can't stand to see that. My little cousin used to flip her eyelids back, like that. You ever had friends that did that? Gross. She'd do that at night when we were sleeping and turn the light on. She was disgusting. I was like, what is wrong with you? There's something wrong with you to do that. I know. It gives you nightmares. Okay, so management, of course, with everything with your eyes is safety, but big time macular degeneration. You want to make sure they have safety. You know, they have community, they have organizations that'll help you, pamphlets, leaflets, call a social worker, call the case manager, get involved, Google, print stuff out for your patient, anything that can help them, and then look around the community, and they always have community stuff for people who have this, because they get depressed if they can't see. Especially, what if you're alone and you have glaucoma, or you have, you know, macular degeneration, it's getting worse, and you know your eyes are going to be fading, you never be able to see your children, grandchildren, your pets, your kids. You know, that's got to be, I could not, I don't think I could handle it. Go ahead.
Well, they all know, but my ex-husband had 5 strokes and basically
Yeah, you told me about that earlier.
blind. He's got about 30% maybe back, but it was interesting to watch the transit, not interesting for him, but the
No.
transition, it was so sudden, it was overnight as far as, he was very, well, depressed for a long time, and he wouldn't work with like Lighthouse. He wouldn't work with them because they kept telling him that after 1 year we'll see how much you get back. But
That's sad.
yeah,
Does he work with them now, the Lighthouse of the Blind?
no,
He didn't?
It's been a couple of years. No, he hasn't. He's in a nursing home, and
Oh.
he's kind of just resolved himself to where he is.
So his depression and stuff,
He
yeah.
doesn't really, I mean, you know, he doesn't get to be active with our daughter, and he's really just kind of let go of a lot.
That's a
He
shame.
used to be like your dad, very active outside, always busy with something.
You know,
He's been stripped.
yeah, he let this take over. Remember we talked about spirituality, mind, body, soul, healing. He let it all. See how everything comes together. Y'all have learned, you know, perfusion plays a big part of this. Genetics, you know, a lot of the concepts y'all learn all kind of blend together. So anyway, that's, you know, so yeah, it's a mind thing.
Speaking of the safety issues, he kept wanting to be able to go home, and we were like, you can't even walk without, you know, well, it took him forever to walk again, but, and he really doesn't now either, but when he was able to do a few steps, I mean, he was always running into the walls, and,
Right.
you know, but he wouldn't work with the Lighthouse of the Blind, so if you can't do
That was great.
you can do the other.
I want to talk about that in a minute. If y'all have a person who has some type of visual impairment, y'all need to work with Lighthouse of the Blind, because my dad did. It was phenomenal. And then the tools and the aids they gave him
Yeah, absolutely.
were great. And you know, the funny thing is, they told him, you know, my stepdad, I'll get you in a second, my stepmother, she would want to go with him, 'cause she wanted to do everything for him. And she attributes a lot to the way, you know, caring for his health, which is great. But they said, no, you can't go. They'd come pick him up in the car. He'd have to get to the car. He'd get in the car. He'd go do and everything by himself, because they wanted him to learn to do everything and be independent by himself. But they gave him this big thing for the screen, for the TV, you know, and everything. It was really cool. What were you going to say?
Is that Lighthouse for the Blind national?
You know, I do not know that. I should, I guess, but I don't.
Available in almost every state, I think, but I know it's like Louisiana has a Lighthouse for the Blind with certain areas
Right.
that they cover.
Do you know, Ms. Vickers?
I had a patient in, I think it was, Rwanda, and he, the Lighthouse of the Blind gave him this big, it's like a magnet, well, I guess like a reader.
Yeah, the reader.
He can,
That's what's your name?
you can read the
Michelle.
newspaper every day because that's just one thing.
Michelle was talking about that for her grandfather. Yeah, that he got one of those too.
They're pretty big out here in Louisiana.
Yeah.
And like even some of the rural areas that they will come in.
They'll reach out. What are you going to say?
They have different programs. Because I'm from Georgia. I don't know what it's called in Georgia or if it's the same thing. But we had, even growing up, like we had guys who needed the magnet.
Right.
And they had to have special printouts for them in my class. And they would put you on that. They would come in and work with them.
Right.
I don't know what it's called.
Right, but they do have in different states, you can find something for everybody. It might not be the Lighthouse of the Blind. Also with this, with safety issues and all, they're going to have to stop driving. Large print, we talked about that. And then what about assistance? They need a lot of assistance. So like you were saying about your husband, if they don't, you know, take care of themselves, XXX, take care of themselves, then they will end up in assisted living, you know, so, yeah.
My sister-in-law husband, I don't know, said he's still the images, but I don't know, you know, when his blind with his computer.
Uh-huh,
But he can still see like images and stuff when he's at home.
uh-huh,
His
He
I
takes,
don't know if he's attached to some kind of organization,
uh-huh,
but he does well for himself in his house.
uh-huh,
And, you know, she sets everything up on physical unity.
Right.
You know, because you're familiar.
you can do that and live blind. I mean, people live blind from birth, you know.
So he has family members, they come pick him up and
Look at Stevie
take
Wonder.
him out and do all
Right.
that stuff. So I don't know what the progression is. I mean, if he can, it can be,
He can still be it depends what he has.
yeah, I don't know.
But it's still, you're very functional as a blind person. You know, remember this, I was talking earlier about if you can't see, then you have to have, think about this when you're discharging or you're teaching or you're sending someone home or you're a home health nurse. Think about this. If they can't see or they just currently became blind or they can't see, that they need aids for like something that they could hear. So if they can't see, if somebody comes in the house, they would need a large a doorbell maybe, you know? And if they can't,
Here very well. He said since he's blind, his hearing has.
right, because what happens is one sensory stops. You know, if you're blind, then you're hearing, you're more keen to hearing. And if you can't hear, you're more keen to sight or smell. Lots of times hearing or blindness and smell go together. They can smell. So if you can't use one sensor, remember that the other sensory that you can use becomes more keen, and you can use those aids and stuff in the house for the person at home. You stretching or you got a question? Okay. I want to stretch too. So I do, my back's killing me. So, okay, refraction errors. Anybody else have any questions about macular degeneration? Okay, so refraction errors, it's a bending of the light rays from outside the world. And this is just myopia. How many of y'all wear glasses in here? Wear glasses, right, we all wear glasses. I wear glasses because I have presbyopia, which is age-related. I never wore glasses until I got older. But if myopia, it's nearsight, so you can see near. And then hyperopia is farsightedness, so you can see far. So it's the opposite, and you have to wear, you know, glasses for whatever. Anybody had LASIK surgery? LASIK, nobody? Yes, did it help?
Yeah, it helped a lot. Like, I could see like immediately a week after.
Really? A week after, so, okay. Yes?
My grandmother had LASIK like years ago.
Uh-huh.
And she actually got glaucoma from it because I guess they gave
Oh, wow.
her eye with laser. And I'm talking like it was like 1980s or something like that.
That's scary.
But she was completely blind in one eye and she had progressive glaucoma.
Wait, y'all listen. Shh.
But she went completely blind in one eye.
Uh-huh.
And progressive glaucoma in the other. And I mean, she was like 40 at the time. Like it was automatic. Like as soon as she got it done, she walked out.
I always worry about that.
And progressive glaucoma.
Right. So that's trauma to the eye. You see, that's an example of trauma. So, yeah. So that's all. This is just to know the different ones, and they both causing from eye open overbends in the light, and the hyperopia, farsightedness, refraction from weak causes images forced behind the retina. Different ways, just nothing, just a little FYI for you. So, okay, so now we have these are some things real quick that may result of you having eye strain, computer vision syndrome, where if you're looking at the computer for a really long time, you know, signs and symptoms of eye strain, headache, blurred vision. You probably get that a lot if you're looking at the computer like we do all the time. Your eyes start hurting, like mine, or you have dry eyes, shoulder pain, eye irritation, redness, burning. So what you're supposed to do, you're supposed to every 20 minutes look far away 20 feet, blink your eyes, and for at least 20 seconds, blink more to make sure your eyes close, your lids close, and they open completely. And that's supposed to help. Okay, so what is this, you guys? Macular degeneration. Cataracts. You miss seeing that poor, beautiful butterfly, huh? We always think about that. Glaucoma, cataracts, and last one, glaucoma. Okay. So that ends this part of the lecture. So I'm going to close this out and